If you're over 60, what I'm about to tell you could save your life. Every year, hundreds of thousands of people suffer a heart attack, and many never see it coming. The frightening part is this: some never experience the crushing chest pain you see in movies. Instead, the warning signs can be subtle, easy to dismiss, and dangerously easy to ignore. Today, I'm going to reveal 7 heart attack symptoms that doctors never want you to overlook, especially after age 50. One of these signs is often mistaken for indigestion, and another is commonly dismissed as stress or anxiety. Stay with me until the end because the final symptom surprises even experienced physicians. Before we begin, please take a moment to subscribe to the channel and turn on notifications. Our mission is to help older adults stay healthy, independent, and informed with life-saving health information. And while you're watching, leave a comment below telling us your age and where you're watching from. I'd love to hear from you. Now let's begin. Most people believe a heart attack and cardiac arrest are the same thing, but they're actually very different. A cardiac arrest occurs when the heart suddenly stops beating properly due to an electrical problem. A heart attack happens when blood flow to part of the heart muscle becomes blocked. Without oxygen-rich blood, heart muscle cells begin to die. Every minute that passes increases the damage. This is why doctors often say, time is muscle. The faster treatment begins, the greater the chance of survival and recovery. Unfortunately, many people delay getting help because they don't recognize the warning signs. They convince themselves it's nothing serious. They think they'll feel better after a nap. They blame stress, fatigue, or a heavy meal. Sometimes that delay can change the rest of their lives forever. Let me tell you about a patient who taught me an unforgettable lesson. She was a woman in her late 60s who walked into a clinic without appearing seriously ill. She wasn't clutching her chest. She wasn't gasping for air. She simply said she hadn't felt right for a few hours. She looked pale. Her hands were cold and clammy. She was sweating even though the room was cool. She described a strange pressure in her upper abdomen. At first glance, many people would have assumed it was a stomach problem. But something didn't seem right. Further testing revealed she was having a major heart attack. Had she ignored those symptoms and gone home, the outcome could have been tragic. That's why today's information matters. Let's start with warning sign number 1. Chest pressure or chest discomfort. Notice I didn't say chest pain. Many heart attack victims never describe the sensation as pain. Instead, they report pressure, tightness, squeezing, fullness, heaviness, or a feeling that something is sitting on their chest. Some compare it to severe indigestion. Others say it feels like a heavy weight pressing down on them. The discomfort may come and go. It may last only a few minutes before returning again. Many older adults dismiss it because it doesn't seem severe enough to be a heart attack. That assumption can be deadly. Warning sign number 2 is nausea or vomiting. This is one of the most overlooked symptoms, especially among women and older adults. Imagine suddenly feeling sick to your stomach for no apparent reason. You haven't eaten anything unusual. You don't have a stomach virus. Yet you feel nauseated or begin vomiting. During a heart attack, damaged heart tissue releases chemical signals that can affect the nervous system and trigger feelings of nausea. This doesn't mean every upset stomach is a heart attack. Far from it. But when nausea appears alongside other symptoms we're discussing today, it deserves immediate attention. Now here's where things become even more concerning. Warning sign number 3 is dizziness or lightheadedness. Many people assume they're dehydrated or simply tired. But during a heart attack, the heart may struggle to pump enough blood throughout the body. When less blood reaches the brain, you may suddenly feel dizzy, weak, faint, or unsteady on your feet. Some people describe feeling disconnected from their surroundings. Others feel as though they might pass out at any moment. If dizziness appears suddenly and is accompanied by chest discomfort, sweating, nausea, or shortness of breath, seek medical help immediately. Warning sign number 4 may be one of the most important signs on this list, yet many people ignore it completely. Suddenly breaking into a cold sweat. Picture yourself sitting quietly. You're not exercising. The room isn't warm. Yet sweat begins pouring down your face. Your skin feels cold, damp, and clammy. Your clothes become soaked. Many heart attack survivors later report that they knew something was wrong because they started sweating profusely for no reason. Doctors believe this happens because the body's stress response becomes activated during a heart attack. The nervous system floods the body with signals that trigger excessive sweating. Sometimes this symptom appears before chest discomfort. Sometimes it's the first clue that something dangerous is happening. And if you think that's surprising, wait until you hear the next symptom because it's one of the most commonly misdiagnosed warning signs of all. Warning sign number 5 is pain that spreads beyond the chest. This is where many people become confused. The heart doesn't always send pain signals directly to the chest. Instead, discomfort may travel to the left arm, right arm, both arms, shoulders, neck, jaw, upper back, or even the upper abdomen. In some cases, jaw pain is the most noticeable symptom. A person may think they have a dental problem when they're actually experiencing a heart attack. Others feel aching between the shoulder blades or discomfort down one arm. Because these symptoms seem unrelated to the heart, precious time is often lost. Never ignore unexplained pain in these areas, especially when combined with any other symptom on today's list. Warning sign number 6 is shortness of breath. Have you ever felt winded after doing something that normally wouldn't leave you breathless? Maybe walking across a room suddenly feels exhausting. Maybe climbing a few stairs leaves you gasping for air. During a heart attack, the heart struggles to pump blood efficiently. As a result, oxygen delivery throughout the body becomes impaired. Your lungs and muscles begin to feel the effects. For some people, shortness of breath appears before chest discomfort. For others, it develops alongside sweating, fatigue, or dizziness. Many older adults assume they're simply getting older or out of shape. But sudden or unusual breathlessness should never be ignored. And now we've reached warning sign number 7, the symptom that surprises many people and often delays life-saving treatment. An overwhelming feeling that something is terribly wrong. Some heart attack survivors describe it as a sense of impending doom. They cannot explain it logically. They simply know something is wrong. They feel anxious, restless, frightened, or unusually uneasy. This sensation can closely resemble a panic attack. In fact, panic attacks and heart attacks share many symptoms, including chest discomfort, sweating, dizziness, nausea, and shortness of breath. The difference is that a heart attack can permanently damage the heart or even become fatal if left untreated. That's why it's always safer to seek medical attention rather than assume it's anxiety. If doctors determine it isn't a heart attack, that's good news. But if it is, early treatment can save your life. Now there's something especially important that older adults need to understand. Heart attacks often look different in people over 60. Women, people with diabetes, and older adults frequently experience what doctors call atypical symptoms. Instead of severe chest pain, they may notice fatigue, mild breathlessness, indigestion, sweating, dizziness, jaw pain, or back discomfort. That's one reason heart attacks are sometimes missed until significant damage has already occurred. Never assume a symptom is harmless simply because it doesn't match what you've seen on television. Real heart attacks are often far more subtle than Hollywood would have you believe. So what should you do if you experience these warning signs? First, don't ignore them. Second, don't wait to see whether they disappear. Third, don't drive yourself if symptoms are severe. Call emergency services immediately. Sit down. Stay as calm as possible. Inform a family member or neighbor if someone is nearby. Remember, every minute counts. The sooner treatment begins, the better the outcome. Many people who survive heart attacks later say they almost didn't seek help because they thought it wasn't serious enough. They nearly made a decision that could have cost them their lives. Don't make that mistake. Your body often whispers before it screams. Learning to recognize those whispers could save your life or the life of someone you love. Before we finish, I want you to remember one simple message. A heart attack does not always begin with crushing chest pain. It may begin with nausea. It may begin with sweating. It may begin with dizziness, jaw pain, unusual fatigue, shortness of breath, or a powerful feeling that something isn't right. Listen to your body. Trust your instincts. And never be afraid to seek medical help when something feels wrong. If you found this information helpful, Please subscribe to the channel and turn on notifications. Every week, we share evidence-based health information designed to help adults over 50 live longer, healthier, and more independent lives. And now I'd love to hear from you. Have you or someone you know ever experienced any of these warning signs? Share your experience in the comments below. Your story could help someone recognize a heart attack before it's too late. Thank you for watching, stay healthy, stay informed, and I'll see you in the next video.